Josh with Iowa American Rescue, and on today's Medic Minute, we're going to look at part 1 of sucking chest wounds and how to place a chest seal. A sucking chest wound is an opening in the chest cavity that allows air to be sucked into the chest because of the negative pressure created by the normal process of breathing in. The simulated wound is going to experience some bleeding, which is something that you could expect in a real injury. One of the first things you should do is assess both sides of the patient to look for a possible exit wound. This patient has a plastic posterior, which is going to cause some problems for the surgeon later on, but it's not something we need to worry about here. The vented hyphen chest seal is the device we are looking at today and is one of the best chest seals on the market. It is extremely sticky and should be placed directly over the opening. Something you will notice is that this chest seal comes with a small gauze pad inside. You can use that to pad the wound and try to wipe away any blood or debris. If you don't have that with you, or you've used up the one that comes with it, you can wipe the blood away with anything that you have, provided it's as clean as possible. Blood and air may possibly escape through the vents, which is appropriate. Even though this probably won't reduce the pressure in the chest, it will prevent more air from building up, which will almost always be harmful to the victim if not prevented. In part 2 of sucking chest wounds, we will look at some field improvised ways of applying chest seals when you do not have a commercially manufactured one nearby.